Good afternoon, Hoosiers. Thank you for joining us again this afternoon. It is Tuesday. We'll be back at the normal time, same place, same time, on Wednesday next week. But we wanted to get this out of the way as the holiday approaches, and approaches fast. So if you're not done with what you should be done with, get out there and get it done. But we do have a full show, so we'll get right at it. Dr. Box will talk about our positivity rate, some new information on that front. Dr. Weaver will talk about our vaccination distribution effort. Senator Todd Young will be joining us virtually, coming right off into the late night last night. He was probably up in the wee hours of this morning, but with the new stimulus package, he's going to be able to give us some details on the progress that was made. But before we get to that, I have just a few quick housekeeping items. Number one, you'll recall some months ago, early in the pandemic, I issued an executive order to allow individuals who weren't currently licensed in the state of Indiana, who did want to answer the call to help on various fronts. I'm going to extend the executive order to ensure that continues for the next 90 days. This applies to retired healthcare professionals, healthcare students, even some out-of-state healthcare professionals to continue to be able to help. So the executive order will be extended by 90 days. It will also allow certain people to administer the COVID-19 vaccine itself, and I'm referring specifically to, right now, members of the Indiana National Guard, all of whom have had the appropriate and proper training to carry out that mission. The order will also continue to suspend certain requirements in order to expedite the hiring. We're constantly hiring over at the Department of Workforce Development, and we'll be able to continue to do that and hire and train temporary workers to move quickly to resolve the unemployment insurance claims. And lastly, also, you'll recall, as I was just talking about the Indian National Guard, we deployed about over 1,300, about 1,350 members of the Indiana National Guard into our 534 long-term care centers all throughout the state of Indiana, and that was set to expire at the end of this month, which is also fast approaching. We're going to extend that. They've been a godsend, quite frankly, and we hear from these long-term care centers saying, we don't want you to leave, and we're really kind of hitting our groove right now, and it's good teamwork. But they're helping with screening and helping doing some of the clerical functions and so much more. And so we'll be extending that mission through the end of February, so well into our vaccination process and protocol. And I suspect General Lyles is with us. He's in the other room, but I suspect there'll be there'll be about 1,000 guards, men and women, out throughout the state of Indiana. And with that, I'll turn it over to Dr. Box for some recent updates.
Thank you, Governor. Good afternoon, Hoosiers. I hope you all have a blessed holiday. This week, we're thrilled by the news that the Moderna vaccine has received its emergency use authorization from the FDA. This is yet another vital tool in the work that we can use to control this virus that has impacted all of our lives. It's incredible to realize that we've already administered thousands of vaccines in just a week's time. And Dr. Weaver, of course, will give us more updates soon. As with the Pfizer vaccine, initial supplies are limited, and we will continue to prioritize getting the vaccine to those healthcare workers who have been on the front lines of this pandemic from day one, and our long-term care staff and residents. Protecting our healthcare workforce is more important than ever, as we continue to see high hospitalization rates across the state. We continue to see more than 3,000 Hoosiers hospitalized with COVID or COVID-like symptoms, which is consistent with where we've been the last couple of weeks. We've also had almost 400 people admitted for COVID or COVID-like symptoms on December the 14th. These numbers are stressing our healthcare system. We saw the effects over the weekend when a significant number of central Indiana hospitals went on diversion due to lack of beds and staff. Unfortunately, the number of Hoosiers confirmed to have died of COVID-19 is also continuing to grow. Today, we reported 143 deaths. That brings our total losses due to this pandemic to more than 7,200 Hoosiers. Another 337 probable deaths have been reported based on a clinical diagnosis. These are sobering numbers and not what anyone wants to focus on during this holiday week, but they're our reality, and we have to pay attention and act accordingly to protect the most vulnerable amongst us. I also need to share another update regarding our COVID data. Governor, we've been very transparent from the very beginning about all of our data with this pandemic. I want to let Hoosiers know today that next week we'll be correcting an error related to our 7-day and all-time positivity rates. We also have decided to make a change in the methodology that we use to calculate the 7-day positivity rate for counties. While the error will impact our positivity rate, I want to reassure you that we have confirmed that the number of cases per 100,000 individuals, the positive tests that we have sent to contact tracers, our deaths, and our overall test counts are not impacted by this error. The error we discovered is in the software logic coding used to calculate our positivity rate. The error has existed since we began reporting the data. We detected the error about the time that about 600 new labs began reporting into our system, and we've been working with outside data scientists to verify the issue and to develop a fix. The change to the methodology is how we calculate the 7-day positivity rate for counties. In the past, similar to many states, we've added each day's positivity rate for 7 days and divided by 7 to obtain the week's positivity rate. Now we will add all of the positive tests for the week and divide by the total tests done that week to determine the week's positivity rate. This will help to minimize the effect that a high variability in the number of tests done each day can have on the week's overall positivity, especially for our smaller counties. Both of these changes will be made on December the 30th when our weekly county metric maps are updated. Both will impact our state positivity rate as well as the metrics of some of our counties. Our state positivity rate will be higher, and we expect that there will be a mixed impact for our counties. Unfortunately, like the virus, much of what we have been doing has never been done before in real time by health departments across the country. So we're learning and we're making adjustments to bring Hoosiers the best information that we can. We understand that there will be questions about the error, the change in methodology, and the impact that this has. More to come in this next week as we finalize these changes. Most importantly, I want to say that we are very sorry for this error. I thought it best to notify everyone as soon as we were confident that we understood what had happened and how to fix it. And we are confident of both of these, Governor. And finally, I want to remind all of you to continue to be vigilant as you celebrate the holidays in the coming days. Don't put yourself or someone you love at risk unnecessarily, because we all want to celebrate together for many holidays to come. And now Dr. Weaver will give us an update about our progress on vaccines.
Thank you, Dr. Box. Last Friday, after all of our vaccinating hospitals received their first shipment of the Pfizer vaccine, the state of Indiana began vaccinating thousands of healthcare Hoosiers daily. We witnessed tears of joy, excitement, and above all, relief. Relief that we are one step closer to being on the other side of this pandemic. As of this morning, more than 33,000 Hoosiers have received their first dose of vaccine to protect them against COVID-19. By the end of the day, that number will top 40,000. Another 50,000 Hoosiers have scheduled appointments to get vaccinated by January 4th. That includes almost 8,800 people who will get their vaccine today alone. This past weekend, the FDA issued an emergency use authorization for a second vaccine made by Moderna. Yesterday, Franciscan Alliance and Hammond received the first shipment of Moderna vaccine in Indiana. Think about that. In just a week's time, we have received not one, but 2 vaccines to help protect Hoosiers from this disease. It truly is the hope that we all need. We continue to focus on vaccinating our frontline healthcare workers and are working to expand eligibility for our other healthcare workforce. At this time, we are vaccinating healthcare providers who are taking care of our most vulnerable populations, including those associated with the hospital, long-term care facilities, EMS, and dialysis staff. As we continue to receive more vaccine, we will continue to expand eligibility, with more healthcare personnel getting invited daily. Please be patient and be assured that you are on the list. If you are a licensed healthcare professional who has face-to-face interaction with patients, make sure that your email address is updated with the Indiana Professional Licensing Agency. This past weekend, the CDC's Advisory Committee on Immunization Practices voted on its recommendation for Phase 1B and 1C vaccine allocation. These are recommendations, and it is up to individual states to determine our specific plan. We are once again consulting with our external vaccine advisory committee to help us determine the next groups that will be eligible for the vaccine. With each allocation, we take several factors into account. What is the risk for serious illness and death in the population group? What is the risk of exposure for COVID-19? What is the risk of exposing others, especially vulnerable people? And how much vaccine do we have available, and what are the safety and efficacy rates for that population? Right now, we are 100% focused on vaccinating all of our healthcare providers, and we expect that focus to remain the same for much of January. But next week, we will begin vaccinating our long-term care facility residents. This will be done through a partnership with CVS and Walgreens, which will come into the facilities to provide those vaccinations. We will provide an update on the next allocation groups in the coming weeks after reviewing our Indiana-specific data and the Indiana Advisory Committee's recommendations. We know there is incredible interest in how vaccine is being administered in Indiana. By the end of the year, we hope to unveil a dashboard that will show how much vaccine has been administered in Indiana and include demographics for the people who have received the vaccine. Like our other dashboards, the vaccine dashboard will continue to evolve as we collect more data and have the opportunity to analyze it. Our initial plan is to update it weekly. Finally, we know that many Hoosiers still have questions about the vaccine. We are working to address those through information on our website, FAQs, and through public messaging being developed in conjunction with partners across the state. Our goal is to provide information that allows you to be confident that the vaccine is safe and effective, and to have informed conversations with your healthcare provider. It is encouraging to see the percentage of people who want the vaccine continues to rise. A recent survey that we conducted in conjunction with our partners at the Indianapolis Colts found that nearly 57% of Hoosiers said they would get the vaccine, while 34% said they weren't sure. We want to make sure we get the necessary information to that 34% so they can make the choice that's right for them. I want to thank everyone who has walked alongside us in this journey. I have seen a lot of excitement in my hospital colleagues who have received the vaccine, and it is our goal to bring that same excitement to all Hoosiers.
Thank you, Dr. Weaver, and thank you, Dr. Box. Last night, just before midnight, if you were watching at home or if you were looking at one of your screens, you probably got a message across the screen that said that Congress had passed a nearly 6,000 page spending package combined with a COVID relief bill. The COVID bill accounts for over $900 million and across the country. Senator Todd Young is with us today to talk about that whole journey. And it was a journey. I know you were somewhat, as we all were, a little impatient and really not just bird dogging, but really pushing. But I want to say publicly express our thanks for, you and I have been in many conversations, as have our offices, but extending the deadline for the previous funding, the additional unemployment support for small businesses, and the resources so that we can continue to test and trace and deliver vaccines in a timely fashion. We're all included in this bill and a lot more. I'll let you dive into that, and we'll continue to dissect this ourselves as a state, work with your staff. Obviously, Indiana went into this pandemic in a strong position, sure footing beneath us. But some unprecedented things washed upon our shores, just as they have with Hoosier families. And what was passed last night is going to help tremendously us get through this and then in turn accelerate away from this pandemic. So Senator Young, I'm sure over the past weeks there was some things you liked about it and some things you didn't like about it, but could you just give us a sense of what is, and I know it's 6,000 pages and I know it was months in the making, but could you try to distill it for Hoosiers to let them know that more than help is on the way, it's on its way right now?
Absolutely. Well, thank you, Governor, for this opportunity, and I, of course, am appreciative of your incredible leadership throughout this crisis. Dr. Box, Dr. Weaver, your entire team has really been incredibly professional and hardworking, and I'm pleased to have this opportunity to share some good news with you through our media from right here in Indianapolis. I did indeed finish last night, and it took months to work through this. Unfortunately, I wish that we could have delivered a product more quickly, but we do have a bill. It's off for the president's signature now, and it's one that will significantly assist, to your point, Governor, our business community, our frontline workers, our families. All those Hoosiers who need assistance. This package is at once a COVID relief package to provide assistance to those individuals and entities I mentioned, and additional resources for testing and vaccinations. It's also a funding for the normal operations of government, one of Congress's most essential responsibilities. So, I will go through those individual provisions. I just want to offer one proviso to set expectations, really for members of the media and members of the public. Since this legislation just passed, there will remain some unanswered questions in the near term regarding implementation of this package. So I know the governor and his team have already begun the hard work of interacting with our federal agencies and our office to get clarity about how all these things are to be implemented properly, quickly, fairly, and I have no doubt that we will implement this package and the programs associated with it more effectively than any state in the nation. So back to some of the top lines. This includes direct payments of $600 per individual and dependent child, so up to $2,400 per family. Some significant hundreds of billions of dollars of assistance to our small businesses, including a second draw of the popular Paycheck Protection Program, extended federal unemployment insurance benefit of $300 per week. This will extend all the way until March of this coming year, and then we'll reassess whether or not that's appropriate. Rental assistance, I know of such concern to so many Hoosiers, and a 1-month extension of the eviction moratorium so that Hoosiers aren't anxious, and we're still ensuring that our landlords receive payment that will be administered through the state and local entities. Some additional money for education, really at all levels, K through 12 and higher ed. Money for childcare. We have, I think we understood going into this, but we are especially appreciative of the important role that childcare plays, not just with respect to keeping our children safe and ensuring that they're in an enriching environment, but also, making sure our economy works so that as people head off to work, they have a safe place for their children to go. Next slide, please. And then there's some money for vaccine development and distribution. I know this is top of mind for all Hoosiers. It's our light at the end of the tunnel. Once we can develop all these vaccines and get them distributed, as Dr. Weaver was indicating, is already in the process of happening. This will only catalyze that effort all the more. Money for testing and related activities by the state of Indiana is included. More money for telehealth, as we've appreciated how important it is for people to be able to access healthcare remotely and free up additional capacity in our healthcare facilities to deal with the COVID pandemic and until we get on the other side of this virus. billions of dollars for ag-related assistance because we know that sector has been hit particularly hard, as has our transportation sector. And then lastly, something that the state of Indiana has requested early on, and it deserved, which was clarity with respect to the ability to flexibly utilize monies from the Coronavirus Relief Fund and get the money to where it's needed most. So we provide an additional year to stretch out utilization of monies for the from the Coronavirus Relief Fund and get it out to Hoosiers who really need it. So that's a quick summary, and I look forward to joining the other participants and taking any questions members of the media might have.
Thank you, Senator Young, and thanks for staying with us for the whole hour and for your leadership on this bill. I know it came down to the wire, but you not only heard every request that every agency was peppering your office with and you with, but acted upon it, and it was just in time to make a huge difference going into the holidays and for the next year. And it's just such an important next 4 months as we're building this bridge to the other side, as Senator Young just mentioned, that light at the end of the tunnel. And this is more than a blueprint to get to that other side and build that bridge. So thank you. With that, we'll go right to the Q&A. We've got Senator Young, we've got Dr. Box, we've got Dr. Weaver, we got General Lyles, and we've also got Chris Johnston from the Office of Management and Budget.
Tom Davies, The Associated Press.
Afternoon, Tom.
Hello, Governor. Thank you.
Yes.
How great, for both you and Dr. Box, how great are concerns over the state's healthcare system at this time? Do you think cases are starting to decrease, or there be more surges over the winter? Do you believe there wasn't a Thanksgiving surge, as you had warned about?
Well, there's, I interrupted your thought there coming out of.
Go ahead.
Look, we're always going to be concerned, and while we celebrate the fact that maybe our surge wasn't as great as could have been anticipated, we are still at an abnormally high positivity rate. So, don't pop the cork. We're at, as we reported today, 12.2% positivity rate. Now, we are managing our way through this. And so if I tend to be an optimistic person, and we are proving that we can together manage our way through this. But as this ebbs and flows from one setting to another and then back again around the world, so we're not unique. We have to be ready and we have to be vigilant. And of course the vaccine gives us an immense reservoir of optimism to draw upon, but it's our responsibility to do everything that we can for one another. And if there's not a reminder in the holidays in that, I don't know where there would be one. You want to
Just
comment?
the ability to be thankful at this point in time for the vaccine, but to get back to the hospitals, I mean, our hospitals are doing an amazing job of managing this and being able to make sure that there are beds, ICU beds, and that there is staff there and able to take care of these individuals. But it certainly has been a struggle. I mean, we've had more hospitals on diversion. Even over the weekend, again, we have had many of our preparedness districts across the state, at least 4 of them or 5 that have had less than 15% of their ICU beds available as of our data last Friday. So certainly there are things that we've looked at and we're concerned about, and we are managing this to date. But as the governor said, this decline we're seeing in numbers is encouraging, but it is certainly leveling off or at an area that is much higher than we would be comfortable with going forward, because we know a certain percentage of all of those individuals will end up in the hospital. I looked at the numbers this past week and we saw more individuals in that younger age group, again, that were making up our positive tests, but we know that that usually translates in, especially after a holiday, in the next 2 to 3 weeks with more of our elderly individuals once again infected. So I'm very concerned about what will happen over Christmas and the New Year's time, and really really want Hoosiers to be very, very careful and to really follow the social distancing, wearing your mask, and as much as possible, limit your celebration to those individuals that are in your household.
Dr. Weaver, anything to add? Yep.
No, nothing. Sorry.
Nope, all good.
Rob Burgess, the Wabash Plain Dealer.
Rob, good afternoon.
Good afternoon, Governor. I had a couple questions for the doctors about the vaccines and then one for Senator Young.
Perfect.
What do we know about the more contagious virus mutations we're seeing in the United Kingdom as it relates to the efficacy of the vaccine which is being used? Does this mean that this is going to be like the flu vaccine where the new mutations mean you have to get a new one every year? And I had a question from a reader about whether or not those who have received the vaccine still need to wear a mask and socially distance, if you could address that.
Both excellent questions. I hear your little ones in the background. That's so sweet.
It could be Senator Young's little one.
Oh, could be. You're right.
I think it's Rob's.
First of all, we do know that this strain exists, and we have seen the data come out of the UK with regards to this strain. To date, we do not think it is a more lethal strain as far as severity of illness and increased deaths, but certainly much more transmissible. People get infected more easily. We do have the ability here in the state, and our lab is testing to see if we see strains of this particular virus here in the state of Indiana, and we can test for a particular protein associated with that. To our knowledge, our vaccines will still not be affected by this mutation in this particular strain, but again, only time will tell that for us going forward. And if individuals who have been vaccinated end up infected, then it's great to test to see what strain that particular individual was infected with. The other question?
The mask.
Oh, the masks, yes. So we are very confident in the fact that this will decrease your chance of getting infected, showing signs and symptoms with the COVID-19 virus, but we don't know whether you couldn't still carry that virus, say, in your nasal and oral areas, and infect other individuals with that. So we really need to have individuals, till we have more data come out through the CDC and through studies on these initial people that have been vaccinated. We need you to continue to wear your masks and social distance until, of course, we get more individuals vaccinated. Lindsay, anything you want to add along those lines?
No, Dr. Box, I think you said everything perfectly. We just really need more time and more data. We know that these vaccines, after you get your second dose, were, several months, 3 to 4 months after those people have received the vaccine, and we're going to continue to follow them over the next several months and years to see how long the vaccine lasts. So until we have that information, we need to continue doing everything that we've already been doing, the social distancing and wearing masks and keeping our gatherings small.
Rob, you had a question for Senator Young?
Hi, Rob. Rob?
Did Rob?
Rob, you should be able to speak.
Yep. Yeah. Sorry, my kids are excited for Christmas here, so I appreciate you bearing with me here.
Yeah.
Senator Young, broad federal aid to cities and states was not included in this relief package, and I've seen this issue framed as a Democratic concern on the national level, but the vast majority of local leaders I've been speaking with who are concerned about upcoming revenue shortfalls are actually Republicans. Why do you think this is a partisan issue at all, and is any help coming in this way for local and state governments in the coming months?
So a couple of thoughts on that. Number one, so much of the assistance that we did provide in this package will make its way down to the local level. So the flexibilities we offered with respect to the Coronavirus Relief Fund will assist our municipalities in a significant way. The testing funding and multiple additional provisions. The other point I would make is there was indeed an effort by some in Congress to try and use this as an opportunity to provide assistance to states that frankly have not done what Indiana has done over the last decade plus, which is to really not just balance our budget, but create a rainy day fund for the rainiest of days that could be drawn down. And it would be frankly a dereliction of my responsibility to allow this to be an opportunity, this COVID pandemic, to pay off unfunded pension liabilities and and to take care of other unwise expenditures and decisions of government officials in states that have not been as wise as the state of Indiana. So, in short, assistance is coming to the local level here in Indiana, but we made a decision not to provide significant additional state and local assistance to many of those other states that have not been quite as fiscally responsible. We will revisit this issue, there's no doubt, and it may require a sort of principled compromise as we head into next year. We also didn't get liability protections, which I think we need for our healthcare providers and our school corporations and many of our manufacturing operations and other employers here in the state. So sometimes you need to set aside certain things you can't agree upon in order to get the urgent relief that Hoosiers and other Americans need.
Yep. And I again, Senator Young, appreciated how targeted you all were with this in terms of local assistance for education/schools, local assistance for renters and rentees, local assistance for food, childcare assistance. That's all on the ground. That's where the rubber meets the road in every small, medium, large-size community. And it's directed that way. It may come through the state of Indiana, but it's directed there. You care to elaborate?
Yeah, that's exactly right. We tried to focus a little less on, entities and more on individual hurting Americans. We made sure that this was targeted towards those Americans who needed it most. And I think we succeeded in large measure in accomplishing our mission.
Thank you. Next.
Demi Johnson, Wish TV.
Good afternoon. Thanks for joining us.
Hi. Dr. Box, you mentioned that because of the error, the state positivity rate would be higher when it's corrected. Do you have any idea how much higher it's going to be? And you mentioned counties would kind of be, local communities would kind of be a mixed bag, but do we know exactly how that's going to impact the overall positivity rate? And then my second question is also probably for you, maybe Dr. Weaver. It's about vaccines, and you mentioned Pfizer is obviously limited. We knew that from the start. We're hearing that from some local hospitals already. Any idea when we could be getting more and how much more we would be getting?
Oh, yeah.
Sure. I can certainly start out with the positivity question, and then I know Dr. Weaver would be happy to weigh in on the Pfizer question. I believe that positivity rate for the state as a whole will go up somewhere between 2 to 3%, and I believe that some of our smaller counties will actually see a decline in their percent positivity. Lindsay?
Yes, so we received a total of 55,000 Pfizer doses on Friday, and then yesterday received an additional 39,000. So we know that we have over 400,000 healthcare providers in Indiana, and so we are not where we need to be, and the hospitals are really doing a tremendous job. I do want to take a moment to say that they have set up very efficient systems to be able to get as many people through in a safe and efficient fashion. So I've heard just wonderful things from my colleagues and from the hospitals about how everything is working. And so yes, they are anxious to get more vaccine in order to vaccinate more people as quickly as we possibly can. So we have already put in our allocation order for the Moderna vaccine and are waiting confirmation when that will receive. We will receive it. That could come as early as tomorrow, maybe Thursday. And then we expect that after we get through these couple of holidays, we'll have a regular cadence of orders. And as we get more information, as we always have been, we'll be very transparent with what we are expecting to receive and when we receive it.
And Dr. Weaver, just best case scenario, again, right now, we are vaccinating our frontline healthcare workers. You mentioned Moderna. Best case scenario, the earliest we would be in our long-term care centers vaccinating residents because of Moderna coming online would be when?
Right, so we just got the Moderna EUA, and part of our allocation for the state this week, we did set aside for long-term care residents, and they'll also vaccinate staff who aren't getting vaccinated at the hospitals, and that's going to start on December 28th, so this coming Monday.
Yep, that's what I wanted to hear. I know you, as the Rolling Stones say, you don't always get what you want, but if you try sometimes, you might get what you need, and we need it. Could you go back to, Dr. Box, what you mentioned, the 2 or 3% increase, but talk a little bit about, with that increase, and you mentioned this in the outset, that it didn't affect our individual numbers. It was the
No.
computation, but that increase wouldn't have, because those individual numbers were what we were looking at, and ICU bed availability rates, vents, doctors. I mean, it wouldn't have changed any decision that we made along the way.
No, and I think that's really critical. If you look at the trend of these percent positivities, even though the trend is higher with the corrected method, the trends are still exactly the same. They were still going up. It doesn't change any of the other metrics.
Right.
I think most importantly, this is our 6th week for every county to be over 200 cases per 100,000 residents, and that, shows the extent of the amount of infection that we have here in the state. So,
Yeah, let's not gloss over that point, because what Tom asked at the outset, you just said 200 per 100,000. We want that 200 to be closer to,
well, if we want to be a blue state,
yeah, well, we do.
10 cases, less than 10 cases per 100,000.
And we're at 200, every county.
Every county for the last 6 weeks.
I'm still optimistic.
Jackie Ryan, the Stark County leader.
Good afternoon, Jackie. Thanks for joining us.
Good afternoon. Can you hear me all right?
Crystal clear.
All right. So I have 2 questions. The first one is for Senator Young. You just mentioned that this bill or the stimulus is focused more on individuals over entities. So I'm just wondering if you can explain how they arrived at the $600 per individual, and then why that's half of what it was when the first stimulus came out in the beginning of the pandemic. And then my second question is about the vaccine distribution. Just since there's a limited supply and healthcare professionals are being prioritized in the first phase, why are we seeing some politicians without healthcare roles receive the vaccine before some other individuals in high-risk professions such as educators? So those are my 2 questions.
Thank you. So for the first question, I'll just answer it very briefly. This package and all the provisions in the package were just a function of compromise, and oftentimes you try and do the best you can with the resources you think are needed to get people through the next few months, and then we can reassess how Hoosiers and other Americans are doing, and then what their needs are at that point. With respect to the vaccination protocols and who should receive vaccinations at what particular time, I follow the CDC guidelines, and the CDC has indicated that, for example, for purposes of continuation of government, certain individuals who are not in a healthcare capacity should go ahead and receive the vaccine. But there are a lot of different policy judgments that need to go into this. We need to take care of our most vulnerable. We need to, at the same time, to Dr. Weaver's point, persuade those roughly 1/3 of Hoosiers who do not believe in the safety and efficacy of this vaccine, that it is indeed safe and efficacious, as our FDA has indicated. So I think all of us have a leadership responsibility to lean into this and demonstrate that we're not afraid. And we believe in the safety and efficacy of this vaccine, and encourage others to become vaccinated.
Yeah, and I would just say that, again, this is, Jackie, just to answer to follow up on Senator Young's comments, this is a partnership between the state and our federal partners, and those, there's direct payments to individuals, there's unemployment insurance assistance from the federal front and the state front, rental assistance, and when you have a state like Indiana, just speaking for ourselves, and we're at a 5% unemployment rate, which is about 167,000 Hoosiers. Now, we recognize that in addition to that, there are some underemployed Hoosiers. So there's the unemployed and underemployed. This package that came out just before midnight helps on both fronts, and as does the state of Indiana will be stepping forward as well, because we can and we will.
Nikki Kelly, the Fort Wayne Journal-Gazette.
Afternoon, Nikki.
Hi, Governor. I have two questions for you today.
Okay.
The first, now that the congressional package has extended the states being able to use that money to next year, do you still plan on setting aside $400 million for the unemployment fund?
Yes.
Use that more quickly to help Hoosiers?
No, that helps Hoosiers, by the way. That's going to us. It's helping Hoosier businesses, which means our employees of the state. So yes, we'll continue on that route, on the 400.
Okay. Then my second question is a little bit personal, but do you know anyone who has died of COVID, and what kind of impact has that had on you?
I don't know anyone personally well, but yes, actually I do. And look, this is tough, and it's tougher on the families, and it's tough enough when you have underlying health conditions that you're struggling with, and then to know this is out and about, and it's unlike anything that we've ever seen, unless you're over 100 years old, of which there are some who are popping off right now saying,
Yep.
calm down, carry on, be smart, keep your wits about you. But it's tough losing someone, and regardless of whether I know them or not personally, I try not to personalize this thing that we're all going through, because we're all going through it together, and I try to do my part, and it's going to be, you have to make decisions on a day in, day out basis, including my wife and I spent Thanksgiving alone, with each other, so that was good, and it could have been worse, I guess. We're looking at Christmas, and how we do that is still under discussion, but it won't be the same, because I want to see my parents next year. And that's why I'm pleading with everyone to be compassionate about their neighbors, and to more than just say you love them. Next question, please.
Lindsay Jackson, WTWO.
Afternoon, Lindsay.
Good afternoon. So I just have two questions for you, Governor Holcomb. What do you say to those who may be concerned with the safety of the vaccine? And then will there be a public health campaign to, convince that 1/3 of Hoosiers to get vaccinated?
I would say trust the science, trust the efficacy of the reports that have come out. The answer to your second question is emphatically yes. There is one underway, and it's both micro and macro in nature in terms of broadcast messaging statewide, and then working with stakeholders at the very street level, ground level. Lindsay or Dr. Box, you might talk about our efforts to date, because I don't watch a lot of TV, I'll confess, but when I've turned it on, I've heard Lindsay's voice, on some television commercials. So I know that is far and wide being broadcast. And you want to comment on that, Dr. Weaver?
I think from the safety and efficacy standpoint that right now you have thousands of people who are scientists. They have gone to school for a really, really long time to know how to really just dive into scientific evidence. And they have all done that, and they are running to get the vaccine. Literally running, saying that this is the best Christmas they've ever had. So I think you can look to those leaders in science and medicine and see that they truly believe in the safety and the efficacy, and all the people that went before them in the trials and have done remarkably well with very few severe adverse events. And yes, we are actively working on a campaign for the vaccine, getting in front of as many groups as we possibly can to talk about it, to talk about the process. Of course, social media, and that will just be expanding over the next several weeks and months.
Erica Heron, the Indianapolis Star.
Good afternoon. Thanks for joining us.
Thank you. Governor Holcomb, you said you will still be spending the $400 million on the Unemployment Insurance Trust Fund. What about the other $250 million? You said some of that may go to other programs, including helping schools recoup some of the money they've spent.
Yes, to be determined, but it shan't be long. Obviously, we have a plan. We're working on some additional business relief. We want to make sure that we are both staying open safely and that our employers can hold on to their employees and or hire more safely. So that's kind of what we're looking at. Now, having said that, with what passed last night, this is why we were working directly with Senator Young's office and Senator Braun's office and our congressional delegation to make sure that we weren't getting ahead of ourselves. And we never did. And so just like we were prudent about, as Senator Young mentioned, making sure that we were building up a rainy day fund while the sun was shining, not when it was raining, we're prepared now to go through the next 4, 5, 6 months and potentially beyond, considering the package that was passed last night. So we'll account for, and what I said remains true, that we were never going to be sending money back. It was going to be directed at the most at those in the most of need, and we're still in the position to be able to do that as the final few days of 2020 wind down.
Steve Garbaz, KPC Media.
Afternoon, Steve. Thanks for joining us.
Thank you. Good afternoon. How are you doing today?
Doing well. Thank you very much.
2 questions, one for Dr. Box and one for Senator Young. Dr. Box, just to clarify, my understanding here is that the main change with the positivity rate is that the state is moving from calculating using just an average of those percentages to actually taking it off the raw numbers in the future, correct? I just wanted to verify that. And then for Senator Young, I know you talked about the bill being compromised on many issues, and we did get $1,200 earlier. So I was wondering, in your opinion, if you were writing the bill and were able to whip the votes for it, where do you think $600 falls? Just right? Too high? Too low? Would you have wanted to do something else?
I'll start, Senator Young. So I would say that there are really 2 things at play here. One of them is correcting an error that we have found in our coding that actually is how we pulled our positive and negative data to calculate the positivity rate. So that will definitely impact our positivity rate for counties and for the state as a whole. The other part of that is, as we are correcting this, we felt like it was an appropriate time to go ahead. As we had started with many states, we were averaging the 7 days of averages to get what the average was for the week. And we really believe now that that does impact some of our smaller counties more so. So we are actually going to change that, as you say, to going to looking at all the positive tests for that week over all the tests that were done for that week per county and per state. Senator Young?
Yeah, excellent question. So in terms of the household payment, the number was just the right number in order to get a bill passed. Hoosier sent me to Washington in order to get an outcome. An outcome oftentimes involves principled compromise. Hoosiers couldn't wait any longer. You know, I put together a package for small business relief back in May. Bipartisan. We have 60 co-sponsors in the United States Senate and roughly 50 to 60 national associations that have been supportive of it. It's called the Restart Act. And so let me just emphasize that this should have passed months ago. And it's unfortunate that it did not, and that the gears of Washington took so long to finally get moving and come together. But we finally got here on account of the willingness of principled legislators who see the world a little differently to come to terms and to compromise. And there was really no other way that we would have passed this bill but for finding a mutually agreeable number. $600 ended up being that number with respect to household payments.
Kayla Sullivan, WXIN.
Afternoon, Kayla.
Good afternoon. I also have two questions. First, I want to know, how worried are you about this new strain of COVID-19 coming to Indiana? Is there anything being done to control that, and any early projections or warnings about it? And then my second question is for Senator Todd Young. Why was a utility shutoff moratorium not included in this package? We don't require the number of shutoffs to be reported in Indiana, but in North Carolina, for example, 20,000 people have had their power shut off. So was there any consideration for that, and why might that have not been included?
Sure. There was indeed. There was an extension of another month of the Centers for Disease Control utility moratorium, as well as rental assistance. So in addition to the $600 per individual, up to $2,400 per family, that level of assistance, there's rental assistance, there's food assistance, various other forms of assistance on top of that. So we took a multifaceted approach to ensure that individual Hoosier households would receive assistance, including not being evicted from their homes.
And Kayla, I would just say that we're appropriately respectful of the fact that this virus exists and that it does appear to be so much more infectious and so much easier for people to transmit. We have worked with our lab to be able to do surveillance for this to see if we do find this in the state of Indiana. But I think it just underscores the importance of those mitigation efforts that we have been, harping on from day one. And the key to that is masking up, because that decreases the spread of this COVID-19 virus, and doing the social distancing that's required, and washing your hands, and staying home if you're sick, and getting tested. All of those things are absolutely critical. We just have so much hope right now with the vaccine, and I'm just afraid people are going to get vaccinated and take off their masks, or just assume, hey, we're just a month or two out from this, and this is going to take a while for us to get everybody vaccinated and for us to really see a change. So very, very respectful of the fact that this exists, and we know that this virus does mutate. We've already seen that.
Yeah, we just got to do the things that we know
work
and help keep our schools open, and folks at work where they want to be. But it takes all of us individually.
Mallory Beard, Fox 55.
Afternoon, Mallory.
Hello, you guys. How are you doing this afternoon?
Very good. Yourself?
I'm doing just fine. Thank
Good.
you. I do have one question I was able to answer. Now, for Hoosiers opposed to getting the vaccine, especially healthcare personnel, what is the risk for unemployment if they choose to not get vaccinated for bodily autonomy purposes?
I'm going to let Dr.
This is after
Weaver
meeting
address
with,
that.
Hoosiers who are opposed to it.
Sure.
Right. So right now we are offering the vaccine to healthcare providers who are eligible. They are getting that information from their employers. So that's part of a conversation between them and their employers. Since this is a vaccine that's under an emergency use authorization, it is advised that right now it is not any kind of state or federal. It cannot be a mandate because it's under emergency use authorization. But further determinations would be between an employer and their employees.
Rich Van White, WTHR.
Hello, Rich. Good afternoon.
Good afternoon. Two quick questions. Dr. Box, in layman's terms, just how stressed are hospitals? How serious are the concerns? What are we in danger of? Dr. Weaver, this has turned into a numbers game, a priority game for a lot of hospitals, as you are probably aware. First concern was having enough people to pull off the mass vaccinations. Now every hospital I talk with is talking about the quantity of vaccines. There's a concern they're not going to have enough. One hospital's expecting something like 2,000 doses of the Moderna vaccine in a day or two. Today got only 500. So is there enough vaccine out there? Is it going to get here quickly enough?
I'll start out, and I think that Lindsay has already alluded to this, but we've been talking about how our hospitals have been basically on high alert and working all cylinders basically nonstop since last spring. I mean, since March. And this has continued, and now they are also our number one partners in getting this vaccine out, not just to our healthcare professionals and our long-term care staff, but they are doing other community health workers that don't even, are not employed at their hospitals. So they have a lot on their plate right now, and they are juggling this and managing this. They've been incredible partners, great collaborators with us, and we need to be respectful of them, and the way that we do that is to not spread this virus, to be respectful of the fact that we should be wearing our masks and socially distancing and all the things that I keep saying over and over again. Lindsay, do you want to comment on the?
Yeah, so of course we would take as much vaccine as we were allocated, and I will say that I'm so happy that right now our problem is that we have more people that want the vaccine than is available, and this is going to be a scarce resource for a really long time, and we're going to continue to work with people to make sure that as soon as we have enough available, that we can make sure that there is people in line. We have been in constant communication with our hospitals around what we should be planning for, and then have had to adjust when we found out what we are actually confirmed in getting. As I mentioned earlier, our hope is that we will get shipments of Moderna tomorrow or the next day, and really by, again, once we get through these holidays and we get consistent shipments of the vaccines, that we'll be able to fall into a better steady state where all of our hospitals will know exactly how much vaccine they have, and so that we can get those appointments filled and scheduled in a timely manner.
Yeah, I would also just say that, I mean, you say, is it enough? Well, I mean, it's not enough for Indiana or 49 other states or other territories or every other nation in the world, but we're thankful that we're at this point right now, and we're not waiting next year or 2 years from now or 10 years from now, as some vaccines have taken. And the point is, we have a protocol in place, a plan in place that extends for weeks out. And to personalize this, I mean, I always point to you and Dr. Weaver and say I'll get my vaccine. I will get vaccinated, but it won't be until my time, and that could be 8 weeks, 10 weeks. It could be February, March, whenever you tell me. But Rich, there is a plan in place, and we're not going to squander or waste or spill that vaccination. We're going to get it into the arms of the willing.
Thank you for joining today's briefing. Governor Holcomb's next briefing will be Wednesday, December 30th